Bronchitis is a common respiratory condition characterized by inflammation of the bronchial tubes, leading to symptoms such as cough, chest congestion, and difficulty breathing. It can be categorized into two main types: acute bronchitis, which is usually caused by viral infections and lasts for a short duration, and chronic bronchitis, which is a more long-term condition associated with persistent inflammation in the airways. In this comprehensive script, we will delve into various aspects of bronchitis, ranging from its pathogenesis and diagnostics to therapeutic interventions and impact on patients' lives. Our aim is to provide medical students with in-depth knowledge and insights to better understand and manage this prevalent respiratory disorder. Bronchitis is an immune response in bronchial walls triggered by infection, smoking, and pollutants. Neutrophil extracellular traps, nets, play a role in the disease. They recruit and activate immune cells, leading to inflammation and tissue damage. Nets in sputum could be used for diagnosis and treatment. In summary, viral infections, particularly respiratory viruses, play a significant role in bronchitis. The complex interactions between the host immune system and viral pathogens influence the development and progression of the disease. Understanding these mechanisms is crucial for effective management of viral bronchitis. In summary, endobronchial optical coherence tomography is an advanced imaging technique that provides detailed visualization of bronchial wall changes in bronchitis patients. It can aid in diagnosis, characterization, and guiding interventions for better management of the condition. Clara cell protein 16, CC16, also known as club cell secretory protein, CCSP, is predominantly produced by non-ciliated bronchiolar cells and acts as a protective factor in the respiratory epithelium. CC16 plays a crucial role in maintaining the integrity of the airway epithelial barrier and modulating immune responses. Studies have shown that CC16 levels are significantly reduced in patients with chronic bronchitis. This decrease is believed to be related to the severity and progressions of the disease. As a result, CC16 has emerged as a potential biomarker for chronic bronchitis, aiding in disease diagnosis and management. Furthermore, the decline in CC16 levels may reflect ongoing inflammation and oxidative stress in the respiratory tract. Therefore, therapeutic approaches focused on preserving or restoring CC16 levels could hold promise in attenuating bronchial inflammation and improving patient outcomes. Genetic factors can determine an individual's susceptibility to acute bronchitis. Variations in genes involved in immune responses and viral recognition can affect the likelihood and severity of the disease. Genome-wide association studies have identified genetic variants associated with increased susceptibility or protection against bronchitis. This knowledge has implications for personalized medicine by identifying higher-risk individuals and guiding treatment selection. However, more research is needed to understand the complex relationship between genetics and bronchitis. Summary: the respiratory microbiome in bronchitis patients undergoes changes, potentially leading to worsened inflammation and compromised immune response. Some microbial species may affect treatment outcomes. This knowledge may aid development of novel therapies for restoring a balanced microbial ecosystem. Pulmonary rehabilitation for chronic bronchitis involves exercise, breathing techniques, education, and support. Exercise improves lung function and endurance. Breathing techniques can reduce air trapping. Education empowers patients to manage their condition. Psychological support addresses emotional aspects. Customized programs improve overall well-being. Inflammation is a major factor in bronchitis, causing airway narrowing, excess mucus production, and tissue damage. Various anti-inflammatory drugs, like corticosteroids, leukotriene modifiers, and PDE4 inhibitors, can help reduce airway inflammation and improve symptoms in bronchitis patients. Inhaled and systemic corticosteroids suppress inflammation by inhibiting the production of pro-inflammatory cytokines and suppressing immune cell activation. Leukotriene modifiers, such as montelukast, block the action of inflammatory mediators in the airways, improving bronchial hyperresponsiveness and reducing exacerbations. PDE4 inhibitors, like roflumilast, target a specific signaling pathway to decrease the release of pro-inflammatory cytokines from immune cells, leading to improved lung function and fewer exacerbations. Understanding how these anti-inflammatory agents work can guide treatment decisions and improve outcomes in bronchitis patients. Bronchoscopic interventions are effective treatments for bronchitis. Bronchial thermoplasty, endobronchial valve placement, and airway stenting provide targeted therapies for severe or refractory symptoms. These procedures have specific indications, limitations, and potential complications, requiring proper patient selection and management. Biomarkers for bronchitis can help predict disease progression, guide treatment decisions, and assess therapeutic responses. Inflammatory markers, genetic markers, and imaging findings have shown potential, but more research is needed to validate their utility in clinical practice. Summary: non-invasive ventilation, NIV, such as CPAP and BiPAP, is effective in managing respiratory insufficiency during acute exacerbations of chronic bronchitis, AECB. NIV improves gas exchange, reduces the work of breathing, and minimizes risks associated with invasive procedures. Timely initiation of NIV reduces intubation rates, ICU admissions, and mortality in ECB patients. Bronchitis, especially chronic and recurrent forms, can significantly impair patients' quality of life and increase morbidity and mortality rates. Various factors contribute to this impact, including the symptoms, exacerbations, comorbidities, and the need for comprehensive care for long-term management. In summary, bronchitis is a significant respiratory condition with inflammation, cough, and airflow limitation. Understanding its mechanisms, diagnosis, and treatment is important for better patient outcomes. We covered topics like neutrophil extracellular traps, viral bronchitis, diagnostic tools like endobronchial optical coherence tomography, biomarkers, genetic factors, respiratory microbiome, patient impact, and therapeutic interventions. This knowledge will empower medical students to provide optimal care to bronchitis patients.